Program management had had an effect on some of the health professionals as disengaging or feeling not as valued. So as a group, we decided to create a vision and to create an environment in which professional practice would be valued. And we looked at the infrastructure and the process and the outcome. The senior management agreed with that approach, and it became part of the strategic direction of the Board of Directors for 2020 to be nationally recognized for our strong professional practice environment, but also for the interprofessional model of care. And they are evaluating, in fact, the CEO every 3 months on this to make sure it moves. So it's a big commitment. Now, essentially what we did out of that is we looked at developing a core contribution in the process where all health professionals identify their core contributions to the whole team. And then we developed an interprofessional model of patient care where all the professionals were at the table together. And then we had 5 teams of patients and family. And essentially, it's a set of guiding principles, 22 guiding principles, and each team needs to confront themselves against the guiding principle. In the 80s, it was evident that there was a real movement into multidisciplinary work. The teams were forming themselves, and intersectoral, transport and security with health and all this. In the 90s, when all the cutbacks came in Canada, and you had a wave of all government doing cutbacks, all of this work went backward. Like everybody kind of went back into their own area and became to protect their turf. The end of the 90s and the beginning of the 2000 has been a resurgence of those teams. And I think it's now repositioning itself in the 21st century. So we define interprofessional using the atom. What it represents is that the patients and the family are the nucleus of the atom. And all of the rings around it are the different professionals that are coming into care. But all those rings intercept with each other. So it's the sum total of it and its integrity that creates the atom. We develop a set of guiding principles called the Interprofessional Model of Patient Care. The model is prescriptive in the way it's guiding principle, 22 of them. Half of them are how the health professionals intervene with each other. The other half is the seamless care between the community to the hospital back to the community. The model provides every team, whether they're close to the model or not, an opportunity and a time to reflect on how you're providing care. Because, we're going at 150 miles an hour with all the workload and delivering care. So that gives you a legitimate timeout to reflect on how you work. And each of the team use it as an opportunity to fix and enhance certain things that bothers them. So one would be that the patient will receive safe and competent care from the most appropriate provider. So then when a team looks at a guiding principle like that, they have to look at how do they ensure safe care and what are the mechanisms and the processes in place and do they do that? How do they ensure competent care? How do you handle the novice practitioner and the competent practitioner and the expert practitioner? We then embarked into implementing this model in 84 different teams. So it is a systems transformation. It's not just a project of one team. And we've started, at this point, we have 10 teams that are in the process. In fact, this week will be the celebration of the first implementation of the first 10 teams. So what's groundbreaking is that I do believe it's the first system transformation that we have in Canada that covers 84 teams in a whole area. And the research, since there's never been any longitudinal research, what impact does it have over time for patients and for professionals? The theory is that the interprofessional should improve the organization of work. And if the organization of work is improved, then the staff well-being will be improved. And then if collaboration is improved, like respect, patient safety, collaboration, and if those two concepts are improved, it will affect the quality of patient care. And once it's implemented, we do the study again 6 months later and 12 months later. And it's a survey methodology both for all the health professionals and for patients.